Royal Ailes here with RSU Public Television, and we're continuing now with our COVID-19 update. And I'm now joined by Dr. Mallgren, who is the medical director of Grand Lake Mental Health for Northeast Oklahoma. And the way Grand Lake Mental Health is expanding, pretty soon the whole state of Oklahoma. So Dr. Mallgren, let's talk about mental health and how it is affecting the people at home right now, being cooped up, can't go out, can't socialize. What are you guys seeing out there in the community right now?
Well, I would like everyone to know, first of all, that we are willing and able to provide mental health services to not all Northeast Oklahoma residents. There's a number that they can call. It's the crisis line, but they will in fact then get you connected with staff if you wish to come in and actually make an appointment. We're doing a whole lot of telemedicine, and that number is 1-800-722-3611. 1-800-722-3611. Now we are, as we are seeing people, most of which is on telemedicine now, part of our standard line of questioning is to ask about the impact that the COVID situation is having on their mental health. We've incorporated that into our electronic records. So that's a question that's always being asked. What are we seeing? Certainly there's some more anxiety. I mean, it's hard. Okay, let's just be straight about that. Just real quickly, I was in college and struggling, and someone simply said to me, it's hard. And that actually validated my personal experience, and I found that reassuring. So it's hard. We know that it's hard. We do provide, certainly as a psychiatric facility, medications. They do play a role, and so there can be quite helpful. Just to be specific, I like specifics. There's a whole category referred to as the SRIs, which work on serotonin, and so we're talking about things like Zoloft, Prozac, Celexa, Lexapro. I want to mention them specifically. They're very safe medications. They virtually are almost side effect free, and they are used in all age groups. So there is that option of medication, and as well, therapy, counseling can do as much or more in some cases as medication. People who do both do best. Now, the reality is that some of these services are going to be difficult for people to set up. And I might actually have I'll be a little tangential here, Royal, and maybe suggest some specific things people can do to help manage their mental health, if you would like me to do that.
Sure, go ahead. How do you manage the mental health?
Well, I'm going to say it's the basics of all human, getting somewhat nutritional meals, getting your rest. I think it's a good idea to get exercise. You don't have to start out running marathons. We're talking about walking around the block. I believe it's very refreshing to get out in nature, especially in the springtime here. And so, that could be a family affair. There's some specific techniques that are not as difficult as people might make them out to be to help manage anxiety. One of which is, and people don't often recognize it, they're very often breathing shallow when they get anxious. And simply placing your hand at the top of your rib cage, if you notice it's not moving, it's time to sit back and just take a couple of deep breaths through your nose slowly, hold it for a little bit, and blow it out your mouth slowly. Now that can be the breath is very powerful. There's things like getting in touch. My father was military and then a police officer, so not real touchy-feely. But let me just say, to look at maybe your emotional state. A lot of irritability and anger, but anger can be the great emotional masquerader. What do I mean by that? It often is more about some deeper underlying scary feelings like fear and sadness. If you're able to at least acknowledge that's present, you can just take a minute to allow yourself to feel that feeling. And you'll find often that it can lessen by giving it permission to show up. It sounds kind of abstract, I suppose, and then it will leave. If you're fighting off your emotional state, there's an old Buddhist phrase, which is that which you resist persists. So allowing it to come in and sit for a minute and pass as though it were a cloud can provide some relief.
Let me ask you this question, Doc. Every winter, people get cooped up, and you expect the winter blues to come in. Are you expecting the COVID blues to hit most of the people in Northeast Oklahoma who are cooped up? Is that something you and your staff is preparing for as we have to go through this together?
Well, absolutely. I'm a Yankee. Actually, I'm a damn Yankee. The difference being is I'm not going back. And seasonal affective disorder, it used to be dark from the time when we went to school and by the time we got home, and very cold. So yes, that's a common problem, probably more so with these circumstances. I again encourage people to wisely get out and to take in nature. And if you're so inclined, if you have a faith at all to take advantage of that, when I say tap into nature, creation, and maybe take it to the next step, recognizing that creation symbolizes the creator. And so, it's possible to tap into almost a soul-like experience. And that's a very personal thing. I would never preach a faith to any particular individual, but there might be something greater than us. By the way, you might kind of be mad at him, okay? And he can handle a cussing, for lack of a better way to say it. This I don't think is his cause. I think it might have had something to do with human free will and some people eating bats. I mean, maybe there's a chain that they have spicy bat wings. I don't know. But,
well,
so
let me follow up on another question. As telemedicine is really taking off. So how are you guys experimenting and learning from telemedicine? And do you see this moving into a new era now as you do your doctoring, for the better term, with your patients? Instead of not seeing them personally, now you're doing it over a laptop.
Our CEO, Larry Smith, was very prescient, almost Trump-like prescience. We've been doing telemedicine since 2010. And I myself always felt that a face-to-face interaction would be more meaningful. And let me just tell you, Royal, some years back, so we've been doing it almost 10 years, I had a poor gal that come in and her child had recently been diagnosed with autism. Her parents and her husband were not very accepting of that. We were able to connect empathically in a way that she emoted. She started to cry, and I'll say that the technology actually dropped away. And that interaction became close to being as meaningful and with depth, all to the pretty darn close to face. I've gotten very, very comfortable with telemedicine. I think most people do rather quickly once they realize that the provider, the doctor, whomever, has made that patient on the other side the total focus of their interaction. No distraction, maybe even better than office visits these days when people are typing and not quite keeping eye contact, that kind of thing. So I'm a big believer in telemedicine. We've been doing it 10 years. Other people finally are catching on to it and catching up with Grand Lake.
Well, that's good. That's good. Know that there's a leader in that industry, and it's right here in Northeast Oklahoma.
Absolutely.
Doctor, thank you for being with us today. I really do appreciate it.
Oh, you're most welcome, Rob.